Lahad, senior journalist, and SP Gupta, retired IS and now chairperson of Kamdhenu Arog Sansthan, a very senior bureaucrat of the country and very socially active for the society and for the country. We have Anita Chaudhary, senior journalist from the country. So we'll discuss here Corona and governance. So part of the governance, we start from the Gupta ji. How you feel, how the government is doing in India for for the corona, how the corona control and whatever way they are going to doing now and going to whatever perform now. Gupta ji.
At the outset, Rakesh, I will just tell you the governance, as you said, is a very important part in this pandemic disease. Governance in India, in the as you called in the first way, has been very fantastic, and all the precautions, what steps needs to be taken were taken by the government. But unfortunately, this second wave, this we could not anticipate. It will be so severe. Government has, come on the back foot. Why? What I feel, the main reason behind it, that in the country there is so much negativity that we could not anticipate, we could not foresee this wave will come. The government just were thinking by now almost this corona pandemic is over, and they did not take that step which they should have taken. And what I feel most important fact was, when they was then the Indian government, when they were successful in making the vaccine, instead of praising our scientists or the government efforts, unfortunately, this opposition parties, they took it other side. They criticized so much. Government thought even the atmosphere in the country was such that people were not coming forward. They were scared. And you say, and the government took a very wise decision that there's only this corona warrior, this health worker, and the 60 plus people, they should be taken first. That was a very wise step, and they took it. Even in that stage also, people were very less. The response was not so much, but anyhow, it was somewhat good. But at that time, opposition parties, they were so scared. Even some opposition party, this Samajwadi party and so leader, he said it is a BJP vaccine, I won't take it. Yani there was so much poisonous atmosphere. That somehow I think government was thinking, by Abhi, we can wait for vaccine, and they even although there was an obligation to export or to give to the outside countries, and they exported it liberally, because in India there was no such demand also, and there was no so much requirement. I think this was the main reason that government could not take step particularly towards this manufacturing of vaccine at the higher speed or what you call faster speeds. And as a
No.
result, as a result, government came on the back foot when this corona second wave became very severe. Nobody could imagine. Government, there was, although there was, as in the media now, there was some warning or some uh, information by the scientists that there can be a second wave, but somehow they do not take it so serious.
No,
What I think,
Gupta ji, do you think the government has just failed to control the corona?
no, I don't think so. But government they could not envisage that though this will be so severe, and atmosphere
Okay.
was such, negativity was so much that government was taken into they took it opposition parties took to as per their own will.
Okay, Alok,
I think
Alokji, just a close observer of the all incident in India as well as in Spain, and Spain also in the grip of Corona. So how do you just comparative the control and the always and the what is remedy and how just government role of government of India and just government of Spain, how we compare the governance of the Spain and India in terms of the control the Corona.
I mean, my observation from the European point of view is that the government of India did a phenomenal job. I'll give you very certain examples. For example, the lockdown started in Spain on 13th of March, whereas in India, in January itself, we had already done the lockdown. So I think we were ahead of our time, and the governance was par excellence. And if we compare it with what has been happening in the West, I think we did a phenomenal job. In spite of the fact that what Mr. Gupta has said, that the opposition, they had a very negative viewpoint, which is very true. Nowhere in Europe did I see that the opposition was not in tune with the government, because this was not the time to play party politics. It was a time when everyone should have joined together and fought against the disease. And like he said, there were people from the opposition party, Samajwadi Party, or could be Congress, or could also have been Aam Aadmi Party. They were looking, they wanted to fish in the troubled waters. This is what was happening. And in spite of the fact that all this was happening, I think our government did a phenomenal job. And Corona was brought under control. When, let's say, in the United States, they were the number one, they were right on the top. And right now, there have been news which has been very negative. India has been shown in a very negative manner. We can talk about this later, but there is a certain reason why this is being done. And I think that is directed, related to the economics of selling the vaccine to the biggest market in the world. That's another thing. As we had written this article in Global Governance News, where I had said was the only mistake which we made was we went into this overconfidence mode. I don't think anybody in the world could have anticipated that a second wave could be there. When we're talking about a second wave in India, we are already into a third or the fourth phase in Europe. And all the mistakes which Europe had made, we did not do a study of that. So probably that could have been, a technical viewpoint that. And there was also this, feeling in the Indians that the corona does not affect the Indian DNA so lethally that people would be dying. So I think otherwise, from governance point of view, unless you come to the last phase where all the festivals were allowed, we could start with Baisakhi in the Golden Temple. People were there in masses, or could be Ramadan, or followed by Eid, or even even what everybody has been talking about. It seems like that was the only reason that this happened, or the elections. But elections were organized in the United States of America also. The presidential elections were done. Out there in Spain, there were local elections done. In the state Barcelona, where I'm living, Catalonia state had their elections. And same, it happened in all the other countries also. So elections was not a major issue. What was a major issue is that in India, we always criticize the government, but we never take into consideration that we have to do our duty as well. Was everybody wearing the mask where it should have been worn? Was
Yeah,
everybody
yeah,
keeping
yeah. You're
social
right.
distance? I mean, it's very easy to criticize the government in
But
spite of
not
their
taking
best
blame.
of the
Yeah.
efforts they did.
Yeah.
Did as citizen of India, did we do our duties well? We did not. I mean, that's as good as that. I mean, if there is a religious leader who's telling you come, it's your life. I mean, God has given us, 2 ears, and in the center we have a head. You
Yeah.
can listen to what somebody is saying, but then God has given you a head to think it over. I mean, we were not doing our duties as citizens of India. We were not doing our duties, and it's very easy to blame the governance. Yes, we were caught on the wrong foot. This is a fact. We had built up these centers which were being dismantled when the second wave struck. But I think the second wave, as we call it, struck us because of our own stupidity. I mean, I'm
No,
not, I'm not trying
Alok, Alok ji,
to.
just you are saying on one hand, just
Hmm.
just for the self ignorance, the corona is spread. Other way, you are showing the government overconfidence. The
It
government
was not only
overconfidence.
government, it was everybody.
No, no,
I mean,
but
people
you
thought we
said,
have the vaccine, but
but due to
vaccine is not the cure. It's a vaccine.
as Gupta ji says, no, this is some problem, some mistakes was there, not properly controlled. But now the vaccine problem, just for the self regulation, we are not maintaining our self regulation, whatever we have already should be. So I now might ask, I'm a question with Anita Chaudhary, who have been covering the Ministry of External Affairs, and I have seen the many part of the world. So how Anita, how do you think just a government part, just corona control, and just other part of uh, the government is here? We just welcome Dr. Abdul Diwale Mohammed ji from London. He is a chairperson of. You are hearing my voice, Doctor? You are hearing me, Abdul Sahab? You are hearing me? Voice is clear now?
Thank you. Welcome. Yeah, I can hear you. Can you
Voice.
hear me?
I
Can
am
you hear
hearing you.
me? Yeah, I
Yeah,
can hear
you
you.
are hearing me? Yeah, okay, thank you. So nice.
I
Well,
can hear
welcome
you
the
loud
show.
and clear.
So nice. So we welcome your show. Dr. Abdul Mohammed ji is the chairperson of the Africa Asian Educational Network, the very big network, and he is also ambassador of the United Nations. In many fronts, he has been doing the lot of social work as well as education. So he's the education giant of the Asia, Africa, and total United Nations. So welcome in the show. So nice
Thank
of
you.
you. You
Thank
are
you.
here. So nice you. So
Welcome.
I'll just after welcoming you, Anita. Just my question was that how just you analyze the situation of corona comparative to other countries, as well as the whatever government of India is doing.
Thank you, Rakesh ji. First of all, if we will go in a comparative mode, then we have to look at first. We have to look at the population of India and other countries. We are the highly populated country, just close to China, and the density is also very high. If we will talk about the governance of the government has done a lot for this country, not only for India, but their neighboring country also and other part of the world also. But if you will talk about the corona period, we have to accept that we are in a battlefield. There is a war-like situation, and India is also the part of that war. First of all, we have to understand what the government has done. Government has India is a developing country. We don't have that kind of infrastructure. The whole world is well aware of that. But if we will talk about the approach and the control, we are one of the most successful country. What we have done in such a critical period and with lots of crises. Not only we have helped our people, but also the whole world. Either we will talk about the vaccine diplomacy, or in first wave, the kind of uh, medicines we have given to the whole world, the different countries who were claiming on that time they are the best in health infrastructure, and they were on that time laughing on India, how the Indian infrastructure is, especially about the health sector. They were not ready to believe that India is able to handle this situation. But India has done a lot. India has proven that India has that kind of ability and quality that India can overcome any kind of pandemic, any kind of situation, and not only it can help their own country, but they can help the other countries also, because India always believe in the Vedic, the history of the India, that is Vasudeva Kutumbakam, and we have given the clear message. But if we will talk about the second wave, there was some kind of lag. Yes, it was some kind of misinterpretation from the government side also, that the wave they were not that much strong, and they were also taken little bit lightly. But the accountability and responsibility of the individual one also. And on that time, the individual has not shown their morality to their society, to themselves, or to their country also.
Okay.
So, if we talk about that governance of the government, I will give them 9 out of 10. But if we will
Oh my God.
talk about accountability of the Indian citizen, I will it will be really a pathetic situation, because still, if we will go roam around the world, this road, and we will saw the impact of the lockdown, we find that people are not bothering about anything. They are not putting masks on themselves. They are not aware about the pandemic rules and all that. If maybe they are aware, but they are not bothering that I have to follow these rules, not for myself, not for my country, not for my family, but the country also. And I will blame the world also, the other countries also, because when it was come to the other countries, we have given all our effort to help them and bring them out from that pandemic situation. But when it has came to India, they have shown their actual color, actual face. And many countries like US also, they have shown all their tantrum and that negative attitude to India, that we cannot help India because of their own rules and regulation. Yeah, but if you will talk about the handling of the government in this Corona period, in this COVID time, the government has done a lot. But yes, the opposition, they have encashed the situation, and they have taken advantage also.
Okay.
So
Okay, Anita ji, just you have given the marks out of 10 to the government and not the public. But you are giving the public 0. This is a matter of the self-discipline for the citizen of the country or citizen of any country around the globe. So now, welcoming Mr. Abdul Diwali Mohammed ji, my question with him is just as a close observer of the old world politics and society and education area, and as well as the concurrent situation of the globe. And you have traveling a lot to the many countries, but I think last 1 year you have just we are just living in the closed door and was trying to see the world from the different eye. So my question is, how do you think the corona control in UK and other parts of the world as well as in India? What do you think? What is your thinking on that?
Thank you very much, my good friend, colleague Rakesh Kumar. First, let's pay condolence to thousands and thousands of people that have lost their life during this
Yeah,
pandemic. It's quite a
we
sorry
all
state.
are with you. We all are with you. All are with you.
Yeah, and first I'll start the fact that Corona is not the worst time in our world. And I say this referring back to the World Economic Forum in 2018 in Davos in Switzerland, which states the theme of that conference was about the fractured world. And so the world has been fractured. We've had so many problems that are confronting our world until Corona came. Corona to us is just a wake-up call. Unfortunately, we've lost many lives. At the same time, during the lockdown, the maternity has been full. So which means invariably we also have to look at the younger children, babies that are being born every day. How do we care about them? Now, there is an inquiry that will be set up in the UK. The government is putting it till next year, even though majority of people are asking inquiry should start right away. And this is just to ensure that we learn from mistakes that have been made so that we can gain in case of similar occurrence in future. Now, we've lost about 100 and something thousand people here in the UK. And it's a sorry state, like I said earlier. But the basic fact there is that Corona has shown, we talk about globalization, but we now say that we're not knitted together as societies, as communities, as people across the world. And if you all take back to when this issue of Corona came up, that was the period when the former president of the United States actually, in his own way, had some conflict and discredited WHO, the World Health Organization. In my belief is that what could have happened is that the world should have come all together and through the WHO, which is responsible to look at the promotion of health across the world. And I tell you, we've got the best scientists in this world to come together and save thousands of lives will have been saved. But unfortunately, what happened? Every country was competing to make vaccines. And I can tell you today, vaccines has even become a business. So these are quite unfortunate in society that we live today. So we live in a shrouded society, in a shrouded world, where sometimes you not know what is right and what is wrong. That quite millions of people have benefited from this corona, which is normal in real life. Scientists, medical engineers, even everybody benefits from whatever. Even when you have war, people produce ammunitions, they make profit from it. But however, the lesson is we need to come together as people to be able to solve issues because the world lacks nothing, whether it's experience of saving society, saving lives, building societies, and in finding solutions. Or before I go to that, what happened in India is quite unfortunate. We know people will say India produces most of the vaccines that's been displayed across the world, and even giving out to some other countries, as part of their contribution to society. And what happened in India, because you look at Africa and India, Asia, they all have similar geographical terrain. So what's happening in India should be a great concern to many other countries many developing countries. Because before we were thinking that it was in the West where the weather is a bit quite different. So Corona might be more, than what will happen in Asia, in Africa. But unfortunately, it has proved us wrong. And so what is there is that, and even when you know that the chairman of the WHO today is an Indian, the prime minister, I mean the honorable minister for science and technology, is current chairman of the WHO, World Health Organization. So, and it's a shrouded thing that we are all going through because we all know in the past years back, I remember when I travel, sometimes I see, but particularly Indonesia, I would remember by Indonesia and some other countries in Asia, even in China, where you have people covering covering up their noses and their mouth. And I wonder, oh, what's wrong? But it has come to reality. We need to look at maybe what you call climate change, but many other things about in terms of our environment. So we need to see the best that can be happening in India now is for everybody to come together and understand that the life of one person is the same as the life of others, and we have to be able to try to protect each one another. You have to be able to save our society, particularly the younger ones that look up to the adults. So,
Yeah, yeah,
so basically, what I'll just say is that it's a shrouded story because with time, we might find the facts about this
yeah.
corona. Because I think I watched a film before corona came up, which the governments are asking society to do that was actually in this same film. And so there's a lot of things shrouded in these stories that people, but then the most important, we should all try to keep safe, keep well, and our prayers go to those who are still having the symptoms, and also we condole with the families of those who have lost their loved ones.
Now, Mr. Abdul, just you have given the perspective the world over how Corona is affected and going on, how just you realize, how just you experiences. The last, I think, 16, 17 months, do you travel any part of the country, any part of the world?
Well, it's because we here, that's a very good question. Here
Hmm.
on the May 17th, there was a relax on terms of restrictions. Even
Hmm.
though even at the moment, if you have to travel, it has to be if you are on business, and that business was genuine for you to travel, or else you pay about I think about 10,000 pounds. If you're caught in a level where you mislead the government. So, and even holidays now, even now we know that we have people, countries that are being on green, on amber, and those that are red. So on the green ones is that you can travel to the green ones, even though you still have to do a test. There's a test you do, which you go about within 72 hours before you travel. You get that test, and when you come back, you do similar thing. But if you go to an amber area, which even France is inclusive, yeah, at the moment we have green, which is we have Spain, which at the moment that people can travel to. In fact, we love travelers here in the UK, so thousands and thousands have booked their holiday to go to Spain, and because it's a green area. But in at the same time, they still do the test, but they would not need to quarantine when they come back to the country. But if you go to the amber area, it means that when you come back, you quarantine for about 7 to 10 days before you can do any other thing. And the government will check you. They will knock on your door to find out whether you actually quarantine. When it was a bit hard, there was when they had to get hotels so that right from the airport, they move into the hotels to ensure that you quarantine for the 10 days. So that is what is then, and the red one is just a no-go area. So I think, and I think by June 27 or June 21st, the government again will look at what to do. And even I was on the program with Shri Dr. Sandeep Marwa, I think a few days ago, and we were talking about the issue of this, I think OTT, where people can go to the cinema again, and they only have to use OTT. And what we looked at there is that basically there are a lot of things that happens that over here, and I hope the same thing is happening in India, because we know the theater industry. People can't go to the theater, they can't go to the cinema, and so that industry itself pays a lot of tax to government. So what government has done, like entertainment industry, was to make sure that they're able to give some support so that the staff can be, I think about 25%, and then the government also, so that at least the government is able to offer up some support, so that by the time the lockdown is being relaxed and the businesses go back in full, because at the moment now I think people are now eating at restaurants, indoors right here now. Sometimes ago you can't even eat indoors, so you have to eat out. So but now restaurants are being, and cinemas. People can go to cinema now. You can go to your barbing salon and look after yourself. So, but notwithstanding, even now that people are now thinking of traveling, the government is still saying you need to be very, very careful before you decide to travel. There must, because you still have to ensure that you protect yourself. So some families now, some families can see their grandparents, which they haven't seen probably for over almost a year. So things that are being relaxed, but at the same time, people are being very watchful. Now, you see, and we have to be honest with ourselves. Let's be open. For my organization and my person, for anything in this world today, I don't blame anybody in government anymore. And people ask me why. And I say, look, let's understand one thing. People in government are part of the civil society. You see, when we look at people in government as if they're different from us, at the moment we're living in a two world. And one of the things my organization is trying to do is to ensure that we can try to bridge the gap, the widening gap between government and the civil society. We need to work closely together. At the moment now, we're like two worlds. So the basic fact is that whoever is in government is a part of the civil society. So the problem is in the civil society. And until we start to realize that and ensure that we work together in honesty, when I say about honesty and being, straightforward, is that I was surprised, to be honest with you as a person, when we saw this pandemic, why people were allowed to travel, to go to places of worship in large numbers. I felt that was
your concern. Your concern is very, very valid. I'll ask Mr. S.P. Gupta. Gupta ji, just to share with you, Anita ji has given the government of India 10 out of 10, but just about the 0 to the self. This is a self-regulation. We are not regulating self-discipline. So that's good for you and good for the government of India. So as a part of government of India, you have secretary, you have seen the many phases of life. So how do you just analyze, as Mr. Dr. Abdul shared his experiences, on the basis of experiences, how just you analyze the situation for the traveling and for the whatever Anita is marking, what Alok ji was sharing with us. So how do you now visualize the actual situation to control the corona, how the government is doing?
Rakesh, I more or less agree with all my co-panelists. But as far as Anita ji's point is concerned, I am almost 100% with her regarding the control of this pandemic in the first phase. Because that was the government take exceptional and unparalleled steps. And we were first in the world to control that. Regarding cooperation of the public, our Indian public, we people are not self-disciplined. The apt is spare the rod, spare the child. We don't understand. We take pride in violating the rules. When we in the foreign country, we are the maximum. We follow the law. That is the problem with us. But here,
so you think we Indian don't follow the law?
No, my point. Yes, they take in pride in violating laws, and unfortunately, nobody bothers. You just see in the country, this Kisan Andolan. What is this? Open violation, and government is a silent spectator.
Why?
They can't do anything. They are behaving.
Why not government is doing anything? Why not government
we
is
follow
doing
the
anything?
law, but by force. We follow the law, but by force. Whenever we get chance to escape and to break that law, we enjoy all the privileges, the loopholes of the situation, and we do all our efforts. We give all our efforts to how to break this law and how to enjoy.
No,
That
actually, Actually, it's a
Without
part of Anita is part of the concern of the someone other one, whatever Kisan Andolan. But you can't blame the all the public of the country. Most of the public, just Mr. Abdul said and Alok ji shared, most of the public are self disciplined.
Yes, yes,
If they
Rakeshji, I come on that point. I
please,
come on
please,
that point.
please, please,
Rakeshji,
Our
one thing I
public,
want to say.
our,
please,
our,
Gupta ji is sharing something. Anita ji,
yeah,
Gupta ji, just
our,
please,
Anita
let
ji,
the Gupta ji speak.
our public response during the first stage was phenomenal. Public supported so
Because
much.
it was forced. Because it was forced, sir.
No,
The
no, there
danda
was
was
no
there.
force.
All the
Please,
hatkanda was there.
no,
All the
please,
danda and
listen.
hatkanda was there.
No, no,
That was it was forced to follow the law.
no, just see.
Law is for the force, actually. You can't just
Yes,
stare from
there,
there.
there was self-discipline. Nobody was forced. There was no any violation of law at that time. Unfortunately, in the world, I think India is the only country wherever our political parties are not united. As rightly said, Alokji rightly said, this political party are behaving. They are as they are on the other side. Please, this pandemic period, they don't understand. They are doing their politics. Have they ever supported any step of the government? Never. They won't know because their target is only Narendra Modi. They could not defeat in the elections and they want to destabilize this government. But one thing I tell you, they are badly mistaken because this public is very intelligent. Our public is very intelligent. They understand everything. They can't be fooled the public. But this is unfortunate side that they are what government do, they are undoing it. First they spoke against vaccine, then they said we should given the vaccine, then they said it should be given, Narendra Modi should take first, then they said I won't take, then they said it should be for the 45 plus people, then now they are saying it should be 18 to 45. Now they are coming to children. Yani they are
No,
not
no,
allowing any time
Gupta ji, but there is
to
a one
take
point.
the government.
Gupta ji,
Government
there
has
is one.
also underestimated
No,
the strength of
no,
the
no.
power
There
of
was
the
one point. There is also just announcement by the Honorable Prime Minister when he announced the vaccine will be given to 18 plus from the 1st of May. But that I think the stock of vaccine was not proper, or our prime minister was just be, I think, not properly informed about the proper stock of vaccine that should be distributed among all. So I think this is something the miscommunication between the policymakers or
No, no,
between the prime minister and the stockholders of the vaccine.
sir, he did not. He came into the trap of the opposition.
No,
They were
sir.
stretching so much. They were
So
they,
Alok ji, he can defend
they
the
were
government,
forcing
but
the prime
Alok ji,
minister.
as an independent journalist, just although Mr. Abdul just shared his view about the Spain, so just very good renovations about the Spain. So how do you think the government of India, when Mr. Modi, Prime Minister of the country, announced about the vaccination date for 18 plus, was really was in order, and that's what matter of overconfidence, or that was not properly communicated by their officers and policymaker concerned? What do you think?
You asking me?
Yeah.
Okay, first of all, let me tell you one thing. Right here in Spain, people who are 50 years of age, they have still not got their vaccination. I'm talking about the
Oh
first jab.
my
And
God.
in case of India, almost anybody I know who is 40 plus has got at least his first jab. That is to
Wow.
begin with.
Wow,
So,
great.
from this point of view, I don't know why we are criticizing the government so much. They have made their mistakes. Uh, in case we are already giving vaccinations to people who are 18 plus, Let me assure you, the whole of Europe, Dr. Mohammed is with us. He will tell you the only country which is producing the vaccine is UK. Rest of the Europe, they are dependent on India, or they are dependent on the United States, and they are more dependent right now on the United States because AstraZeneca is not able to supply it. And it is not because they're not producing enough.
Oh my God.
Unlike India, they are not ready to share it with the rest of Europe. So what he was saying is like it's a very idealistic kind of situation. What Dr. Mohammed was saying, he was saying like we should have fought together as the united humanity, but unfortunately that's not the case. I mean, on one side we think that European Union has a union, but they were actually really fighting for the vaccinations and they did not have. And
Oh my
same
God.
happened with the United States. For example, I might surprise you that America and Canada, since 1 year, their borders have not opened. So
Yeah.
we are not aware in India of the situation or the privileged situation which India is living. And not only that, it is also helping other nations, like countries in Latin America or in Africa or our own neighbors. We are doing so much, but the problem is that the negative attitude which our opposition parties have, or a set of journalists which is creating this hype, and most of the time, it doesn't even test to scrutiny. I mean, for example, right now we are talking about the third wave. All the doctors, all the technicians, they are telling you that there will be no third wave, and there cannot be a third wave in case we cover our mouths, we wash our hands, and we do a social distance. I mean, just look at it. The same politicians were saying a few months ago that there should be no lockdown. Now, when it comes to them, because in our constitution, health is a state issue, so they should have taken their decision. If you
Yeah.
remember,
That's the point. That's the point. That's
and
the point.
and even then center is helping. I mean, for example, I remember there was a discussion between President Trump and the governor of New York. He said we don't have respirators, and I'm talking about just January. And he says we have given you the money, it is your job to look for the respirators. And this was on live, this was on a press conference. So, I mean, just think of it, how negativity has been created. And I think the whole concept of this is, for example, there was a doctor talking. What our government has not done in India is every evening at the prime time news bulletin, a doctor should come and address the people and educate the people. It has always been in the hands of the politicians. Now that somebody like that should have come and said things like this. They're saying it, but it's in print media, and print media has its own limitations. I mean, what is really incredible is at one time you're saying we are short of oxygen, and once they say, okay, we are going to have a scrutiny of oxygen, you say, no, we have surplus oxygen, now I won't. Now, what is happening with the third wave we are talking about? It is fictitious. It does not exist. Nobody can predict it, that there will be
Yeah.
a third. What is
You're right.
happening is that the biggest vaccine manufacturer is not allowed into India. And it is not allowed into India because it is not ready to even obey the law of India. So now what is happening is they want to. I mean, I was amazed when the
We are
previous
talking
prime
about the
minister,
Pfizer.
I'm
Are you
talking about
talking about?
Pfizer.
Yeah.
They
Yeah.
want to enter the biggest market in the world, which is India, and they don't know how to go about it. And
Yeah.
so they're using their pressure tactics. I mean, just think of it. Right now, President Biden is the president, and he's using the laws which they were against when they were fighting for the election. When President Trump, he clearly said that, this is a warlike situation and we will not give our vaccination to anybody else. Now they're using the same thing to give the raw material to Indian companies to manufacture it. So now there is a situation right now because AstraZeneca has given the patent to us, but you have to deliver, you have to pay a price for that. I'm talking about COVID Shield vaccine, which is being made in India. So now what the opposition, I don't know. I mean, we have people who studied in IIT and, even bigger institutions, and they don't understand that there is a patent onto these medicines. Idealistically, like what should be done is that the patient should be removed. And India and South Africa are spearheading that movement even in WHO. But nobody is ready because this is the time for them to make money. And nobody is ready to give away those patents. I mean, we have our own indigenous vaccine. We have an internationally reputed vaccine, which again, they are giving it a bad name just because they were unable to deliver in Europe and because there is this pharma lobby in the US which is pushing its own vaccine. Now, it is a sense of logical. What I was saying is that a technical person, when he comes and talks about this, it's simple logic. The most vulnerable people were the senior citizens. So in case they have been vaccinated, the second lot would be the middle-aged people. Let's say from 50 onwards. Now, from 50 onwards, if we go down, the most unruly people everywhere in the world are the youngsters. They are going to party. They are going to go to cinema.
Yeah,
They're going to go
yeah.
to the beach.
That's the problem,
They
the
will
big
not
problem.
wear. They will not wear the
Big
mask, or
problem.
they'll not keep social distancing, and they are the most unruly people. Now, in case all these people have been vaccinated, it is simple, plain logic. You don't have to be a doctor. You don't need a degree in medicine for this. The only left is the children. Now, they are playing the emotional card. I'm talking about Pfizer. They are playing the emotional card so that people now get so emotional about this. Oh, my kids are going to get corona and they're going to die. But they also have the best immune system. Like, what is the vaccine going to do? It is just going to help your immune system to fight with the
Yeah,
vaccine. But
they
already
create the antibody. Yeah, create the antibodies in the body. Yeah,
pardon me?
create the antibodies in your body.
Exactly,
This is a
exactly.
work of
Yeah,
vaccine. Yeah.
What
Yeah.
now? They have tried all kind of tactics. The previous prime minister had written to Modi ji before he got that any vaccine which has been accepted in a responsible country should be accepted in India, like without any data being given, without any permissions being given. Why should this privilege be given to any other vaccine? Why COVID Shield needs it, or why Covaxin needs it, or let's say Sputnik needs it, or any other vaccine needs it. Why this should be given to any other? They have to follow the rules of the country. They are not ready to do it.
Yeah.
They're not ready to do it. And on top of it, they're using our politicians, they're using the media to create a panic in India. And not only this, it's part of a strategy that they have. I mean, right at the beginning, they were talking about, oh, we don't know what will happen to India, in case the pandemic comes. Nothing happened to India. Nothing is going to happen to India. So there's a kind of hype which has been created, and that is basically, I think, all this is working in one direction,
So
and that is they
Alok
want
ji,
to sell their vaccine to India.
Alok ji, sorry for intervention. Just you share with the news how many person has been vaccinated in Spain. This is not properly vaccinated in Spain.
I'm telling you, like Spain right now in Europe is in the best condition, but still people who are above 50, not all of them have been vaccinated.
My God, this is a big
I got
info
a
for
call.
us.
I got a call. They said, come and vaccinate. It's time for you to come and get vaccinated. And they give me a time. And after 3 hours, they called me back and they said, sorry, you cannot come tomorrow because we are just vaccinating for 1 hour.
Oh my
Okay.
God. Oh my God.
In case you get into the web page to make your booking, it is quite possible that you are somewhere in Connaught Place in Delhi and you get a booking for Ghaziabad. So you have to go to Ghaziabad to get yourself vaccinated, or the link might not be working. This is quite possible. But then I called them 1 week. They did not respond back. They said, no, we'll call you back. Then next week, again, I called them and they said, no, we have this medical card, and they checked the medical card and they said, yes, you are on the list, but we'll tell you. Today they were supposed to tell me because today they were going to get the vaccines. They don't have vaccines.
Okay. Mr. Abdul,
And I'm not exaggerating. I'm talking to you about what is happening to me.
you
And this
vaccinated
is
yourself.
the reality.
Mr. Abdul, uh, uh, you have vaccinated yourself. Hello. Hello. You hear me?
I can hear you.
My question is, Mr. Abdul, after your vaccination, just you have what is the condition of vaccination in the London and just other parts of Africa? Hello.
Rakeshji,
Yeah.
Rakeshji, I will just take 1 minute.
Please, 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 please.
Uh, I just Alok, whatever he said, I am absolutely with him. He's right, rightly said everything.
Hmm.
One more thing I will add.
Hmm.
This regarding media.
Mm-hmm.
He has also
Yeah,
pointed
yeah.
out.
That is
He has
question. Yeah.
also pointed out.
Hmm.
I have starting to see the TV
Mm-hmm.
because all the negativity,
Okay.
besides political parties, this TV people, this third stage has not yet come, and every day they will say what will happen to children. Yani so much atmosphere is matlab polluting there. There is a conspiracy. I can visualize there is a conspiracy of some this select media, or you can say whatever you say, and these political parties, those who want to marketing this vaccine. I also like to say regarding vaccination, it is not going to help so much. As Alok rightly said, you first go 60 plus, then 40, 50 plus. Why you go downward? This was a wrong decision to open this 18 plus. This was a very wrong. And Prime Minister came into the trap. This opposition party,
Yeah. You are right.
Rahul Gandhi.
You are right.
This was a wrong decision. Otherwise, our system was going so well. There would have been no shortage. And this hype was created with a ulterior motive. I will say with ulterior motive.
You are right.
And this is very sorry state of affairs. I will, Rakeshji, I will request, please, being a media person, you are playing a very good role, and you should expose these people. Because
obviously, if you give us facts, we'll really just expose and just.
They are not with country. They are not with country.
We have 5 minutes, 4 minutes, each minute for everyone. We'll just talk on the role of media in just to control the pandemic. So, Anita, how do you think the role of media just in India and the foreign media? Only 1 minute, please. 1 minute each.
I think their media is working under a agenda and propaganda. They are
in India or in the foreign country?
The abroad media is also behaving like that only, because the pharma industry, the world pharma industry is not able to digest the progressive step of India. And Indian media, if we will talk about the Indian media, they are also behaving like a puppet of secular gang and the leftist gang. And whatever the positive news during this pandemic is coming out, they are not purposely showing. They are showing on the screen, or on if we will go through the paper also, the newspaper also, we'll see we have the Rona Dhona, the negative news, that it's showing like that the India is totally collapsed. The system is totally gone, and the India is not able to survive under the government of the Prime Minister.
Alok.
I mean, we'll have to do a program on this, that who owns our media. So once you know who owns our media in India, you know
this is a big discussion, the role of media to control the pandemic.
Yeah, you are right. Once we start off from there, what Anita ji said, this is very right. I mean, unfortunate part is that our own Indian media people, they are feeding the international media, and don't think that they have done better than us. They have not. The only thing is that they are very image conscious as a country, as the opposition, and their journalists are more responsible because of one reason: we don't care. But what we are doing is, we are, as media people, irresponsible media people, they are making their money. But what is happening is that in the whole thing, you just screwing up your economy. I mean, just think of
Yeah,
it that
you are
Spain
right.
is dependent on economy, and with this irresponsible media that we have, and which is feeding the international media, they are very happy because they want to tell their people, look there, India is on fire, we are far ahead. When the truth is something else. The truth is that we are vaccinating people from 18 plus onwards. People 40 years have already been vaccinated in India. They don't
Actually,
want to.
actually, Alok ji, this is the age binding and the just 18 plus and 44 plus, 45 plus, 60. This is totally, I think, this is a control of the stock of the vaccine that
No,
we
but
have
this is
not.
scientific. This is
This is
scientific. They are doing it from the most vulnerable people to the least vulnerable.
that's
people.
okay, but
It's as simple as that.
also concerned with the stock of the vaccine. We would have the proper stock of
I
the
don't
vaccine.
agree with this, Rakeshji, because
Yeah,
India
please.
produces around 30 million doses in 1 week,
Yeah.
which is
So
more
so
than
so
the
you
population
so
of
so you
Germany.
praise the government of India for
I
how
think
they are
yes,
doing.
telling
They-
people is
yeah.
building up confidence that 18 years old person can also do. So we are not lacking.
So
But
thanks to Gupta ji who raised the question, the role of media. The next program we'll do on the role of media and Corona, how they have this handling and mishandling. So nice of you. You all come in our program of the Global Governance News. Anita ji, Alok ji, SP Gupta ji, and Mr. Abdul. So nice of you. Thank you for your kind presence and your thoughtful thoughts about this Corona and governance. We'll meet next again on this same platform with the new subject. Thank you. Namaskar. Jai Hind.
Thank
Jai
you.
Bharat.
Namaskar. Good
Thank
night.
you.
thank you, Rakeshji.
Thank you, sir. Namaskar.